Chapter 20, Part 2, Vascular Physiology. The topic of this screencast is going to be resistance. When we talk about resistance, we want to think of resistance as the friction encountered by blood. And friction is actually created between contact of blood and the vessel wall. The important thing to remember here is resistance opposes blood flow. So the greater the resistance, the lower the flow. So there's our inverse relationship between the two. Now, peripheral resistance, this is actually the resistance created by blood in blood vessels. So later along the way, we're going to refer to this as total peripheral resistance, or TPR. This will be important when we talk about flow. Now, something that is significantly impacting resistance, or the causes, are going to be viscosity, that's the thickness of blood, the length of the vessel, and the size of the lumen. Now, when we talk about viscosity, we're really talking about the thickness, and it creates its own resistance. The greater the thickness of the fluid, it's greater the viscosity, and there goes the increase in resistance. Now, this depends on the percentage of particles in fluid. Blood has formed elements, it has proteins, and so it's about 5 times more viscous than water. Viscous will decrease with low blood cell count. Viscosity increases when we see someone that's blood doping, so all of a sudden you have a higher than normal cell count or formed elements, or another situation could be with dehydration. Once again, the issue here is increasing viscosity, a greater percentage of cells. Another factor contributing to resistance is the length of the vessel. So now friction will take place along the entire length of the vessel. Typically, this will stay constant, but we may see changes, weight gain, that might result in changes in vessel length. Typically, when we look at weight gain, we're going to have angiogenesis and increased resistance. Weight loss, we have vessel regression, decreased resistance. The thing to keep in mind here, the longer the vessel, the greater the resistance we're going to see. The factor that is most critical to resistance is going to be vessel radius. So now we're looking at the smaller the radius, the more resistance we see. When we talk about flow, one thing to keep in mind here is blood has a laminar flow. And what this is, it's a flow in which is fast in the center of the lumen, but slower near the wall of the vessel. So it's the wall of the vessel that's actually creating resistance and slowing blood down along the sides. Now, as diameter increases, resistance will decrease, and we will see an increase in flow. So relatively less blood flowing along the vessel wall with dilation. And what we're going to see here, flow is proportional to radius to the 4th power. This is really important. So when we're talking about resistance, a factor is the radius, and we're going to take it to the 4th power. So if we look at increase in radius from 1 millimeter to 2 millimeters, the actual change in flow is going to be 16 times greater. So that's really important. So the most important of the 3 factors that we've discussed, viscosity of blood, length of vessel, vessel radius is the most important. And if we think about vasoconstriction, vasodilation, this is a way of actually controlling resistance through vasomotion. Now, one thing we have to keep in mind here, and we're going to go into some fluid dynamics, and we're going to have to talk about flow. So total blood flow, we already know that's cardiac output. So flow is going to be proportional to pressure gradient. So there's our driving force, and that's actually going to be divided by resistance. So now flow is proportional to delta P, okay, change in pressure, and resistance. So if we look at systemic blood pressure, that is going to be our delta P. As the gradient increases, total blood flow increases. So gradient is going to be increased typically by an increase in cardiac output. Resistance in this formula is actually equal to R. As resistance increases, total blood flow will decrease. So resistance can be increasing by increasing the viscosity of blood, increasing vessel length, or as we saw previously, the biggest factor is going to be decreasing the vessel lumen diameter. One of the things that we're going to do in lab is rewrite this formula using cardiac terms. So I'm going to hold off on that here, and this is something that will be covered in our lab activity when we do the cardiovascular physiology lab. Now, this last diagram here talks about the factors that are influencing total blood flow. So here, first of all, we see the pressure gradient. That is going to be generated by the heart. If I wanted to express this in cardiac terms, I said I wouldn't do this, but I'm going to. We can use mean arterial pressure. Flow is cardiac output, and resistance, we're going to be looking at TPR, total peripheral resistance. So the resistance to blood created by the vessels of the body. So factors that are going to increase total blood flow are going to be an increase in cardiac output. What an increase in cardiac output does, it's going to create a much greater pressure gradient or driving force. The greater the driving force, the greater the flow. Another thing that can happen is to change resistance. So if we're looking to increase blood flow, we're going to have less resistance, and this is going to be created by vasodilation, primarily. It could also be a decrease in blood viscosity or a decrease in the length of a vessel. Now, factors that decrease blood flow, now we're talking about a decrease in cardiac output because now there's going to be a lower pressure gradient. The other thing that we can do to decrease total flow is to increase resistance, and this is going to happen through vasoconstriction primarily. It could occur through a longer vessel or an increase in blood viscosity. So these are the factors that can actually, that contribute to our total blood flow.